That's all the information about amitriptyline we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. Dose. Depression. Outpatient, 25 to 50 mg POQHS initially, increase by 25 mg every 5 to 7 days to 100 to 200 mg/day, may divide doses throughout day or give at bedtime, if needed, may increase to 300 mg per day. Inpatient, 100 to 300 mg POQ day. Post-herpetic neuralgia, off-label. 65 to 100 mg POQ day for at least 3 weeks. Migraine prophylaxis, off-label. 10 to 25 mg POQHS, 10 to 400 mg POQHS dose range. Eating disorder, off-label. 150 mg POQHS for 8 weeks. Half-life. The elimination half-life, T1/2 beta, amitriptyline after peroral administration is about 25 hours, 24.65 plus or minus 6.31 hours, range 16.49 to 40.36 hours. Mechanism of action. The mechanism of action of this drug is not fully elucidated. It is suggested that amitriptyline inhibits the membrane pump mechanism responsible for the reuptake of transmitter amines, such as norepinephrine and serotonin, thereby increasing their concentration at the synaptic clefts of the brain. These amines are important in regulating mood. The monoamine hypothesis in depression, one of the oldest hypotheses, postulates that deficiencies of serotonin, 5-HT, and/or norepinephrine, northeast, neurotransmission in the brain lead to depressive effects. This drug counteracts these mechanisms. This may be the mechanism of amitriptyline in improving depressive symptoms. Whether its analgesic effects are related to its mood-altering activities or attributable to a different, less obvious pharmacological action, or a combination of both, is unknown. Pharmacodynamic. Effects in pain and depression. Amitriptyline is a tricyclic antidepressant and an analgesic. It has anticholinergic and sedative properties. Clinical studies have shown that oral amitriptyline achieves, at a minimum, good to moderate response in up to 2/3 of patients diagnosed with post-herpetic neuralgia and 3/4 of patients diagnosed with diabetic neuropathic pain and neurogenic pain syndromes that are frequently unresponsive to narcotic analgesics. Amitriptyline has also shown efficacy in diverse groups of patients with chronic non-malignant pain. There have also been some studies showing efficacy in managing fibromyalgia, and off-label use of this drug. Cardiovascular and anticholinergic effects. Amitriptyline has strong anticholinergic properties and may cause ECG changes and quinidine-like effects on the heart. Amitriptyline may inhibit ion channels, which are necessary for cardiac repolarization, HERG channels, in the upper micromolar range of therapeutic plasma concentrations. Therefore, amitriptyline may increase the risk for cardiac arrhythmia. Orthostatic hypotension and tachycardia can be a problem in elderly patients receiving this drug at normal doses for depression. There is evidence in the literature that these effects may occur, rarely, at the lower doses utilized in the treatment of pain. As with any other tricyclic antidepressant agent, increased glucose levels can occur with amitriptyline. Effects on seizure threshold. This drug also decreases the convulsive threshold and alterations in EEG and sleep patterns. Side effects. The most frequent side effects, occurring in 20% or more of users, are dry mouth, drowsiness, dizziness, constipation, and weight gain, on average 1.8 kilograms. Other common side effects, in 10% or more, are vision problems, amblyopia, blurred vision, tachycardia, increased appetite, tremor, fatigue/asthenia/feeling slowed down, and dyspepsia. A less common side effect of amitriptyline is urination problems, 8.7%. Contraindication. The known contraindications of amitriptyline are: history of myocardial infarction, history of arrhythmias, particularly any degree of heart block, coronary artery disease, porphyria, severe liver disease, such as cirrhosis, being under 6 years of age. Patients who are taking monoamine oxidase inhibitors, MAOIs, or have taken them within the last 14 days. What is amitriptyline used for? This drug is indicated for the following conditions: major depressive disorder in adults, management of neuropathic pain in adults, prophylactic treatment of chronic tension-type headache, CTTH, in adults, prophylactic treatment of migraine in adults, treatment of nocturnal enuresis in children aged 6 years and above when organic pathology, including spina bifida and related disorders, have been excluded and no response has been achieved to all other non-drug and drug treatments, including antispasmodics and vasopressin-related products. This product may only be prescribed by a healthcare professional with expertise in the management of persistent enuresis. Off-label uses: irritable bowel syndrome, sleep disorders, diabetic neuropathy, agitation, fibromyalgia, and insomnia. What is amitriptyline? Amitriptyline, sold under the brand name Elavil among others, is a tricyclic antidepressant primarily used to treat major depressive disorder, a variety of pain syndromes such as neuropathic pain, fibromyalgia, migraine, and tension headaches. Amitriptyline was discovered in the late 1950s by scientists at Merck and approved by the U.S. Food and Drug Administration, FDA, in 1961. It is on the World Health Organization's list of essential medicines. It is available as a generic medication. In 2020, it was the 81st most commonly prescribed medication in the United States, with more than 9 million prescriptions. Amitriptyline is a tricyclic antidepressant indicated in the treatment of depressive illness, either endogenous or psychotic, and to relieve depression-associated anxiety. In this video, let's found. What is amitriptyline? What is amitriptyline used for? Contraindication. What are the side effects of taking amitriptyline? How does amitriptyline work? How to use amitriptyline?